Hi, on this video we're going to talk a little bit about something called the estrogen quotient. And so in my practice I see a lot of women who are concerned about hormone imbalances. Maybe they're having things like heavy bleeding, really painful menstrual cycles. They've been diagnosed with something like PCOS or endometriosis, or they just get really bad cramps and they're down and out for a week or two every month, and they just don't feel like that's right, and they want some answers. I also see a lot of women that are really concerned about breast cancer, and with good reason. 1 out of every 7 women in the United States gets diagnosed with breast cancer, and a lot of women have seen a mom, a sister, an aunt, a grandma go through a really terrible experience with breast cancer, and they want to make sure that they are doing all of the things that they can do to make sure that that's not their fate too. So one of the things that I find really helpful for women who are trying to stay proactive is doing something called calculating their estrogen quotient. And the way that you do that is that you run a hormone panel and you look at the 3 types of estrogen. Most people don't know that there's 3 types, and they focus solely on the E2 form, which is the one that gets all the fanfare. It's called estradiol. But there's actually 3 types. And the best way to look at these levels is with either saliva or urine. And the reason that blood is not a super great way to look at these hormones is because the hormones are bound to the proteins in the blood, and that renders them inactive, versus if they're floating around in urine or saliva, you are looking at a free hormone level, and it gives you a much better picture of what is free and usable and available to you. A very, very small portion of the total amount of these estrogens is actually free and available. So I think first thing is get with somebody that knows how to functionally evaluate hormones, so that you're not looking at something that doesn't really help you get the answers that you want. So then what we do is we calculate these, and we look at, let me tell you a little bit first about what these 3 types of estrogen are. E1 is called estrone, and this is the kind that is produced in your liver and fat cells. And as women start to hit menopause, this is the main type of estrogen that they produce. So your ovaries stop producing the estrogen like they did when you were younger and cycling regularly, and your fat cells and your liver start taking over the job. So if you have, say, excess body fat, then you start to produce more estrogen than you might want, and this level of estrogen gets too high. You can also have things called xenoestrogens, which are products that mimic estrogen in beauty care products, plastics, and things like that. So that's all plays into that. The second type of estrogen is E2, or estradiol, and this is the most common one, and this is the one that gets tested in most people when they get a hormone test. A blood test is done, and it's looking at E2, or estradiol, and it's produced in the ovaries. And it plays a role in keeping bones healthy, skin, and hair. It also helps regulate your sleep, your sex drive, your energy levels. So it's really important. It's also what keeps mucous membranes moisturized. So as women get closer to the menopausal years, sometimes that they feel dry, and that's the reason for that. Um, estradiol is very potent. It also has a very strong growth stimulation property. So if you have excess levels of that, that is what kind of feeds these estrogen-driven conditions, whether it be endometriosis, breast cancer, ovarian cancer, things like that that are implicated by extra high levels of estrogen. Now you take E3, that's the 3rd form of estrogen, and that's what is produced in the breast and the liver cells. So this is a protective form of estrogen. It's also a weaker form, but it has that protective element to it, and it keeps the other 2 in check. So that's why you want this to be high. This is a protective and good form of estrogen. And this is also the type of estrogen that elevates really, really high when someone's pregnant. So what we do is now that we know about all those types of estrogen, we run a saliva panel or a urine test, and we look at all these, and then we can calculate. We can take those, and there was a medical doctor by the name of Henry Lemming that did a whole bunch of research and came up with something called the estrogen quotient, where you take your E3 levels and you divide them by your E1 and your E2 levels added together. And if you've had one of these tests done, you can calculate it. If you visit my blog, www.drjeni.com/blog, and search for estrogen quotient, I posted a picture in this blog article of how I calculated that. That's actually my test on there. And so I felt comfortable sharing that, but I calculated my estrogen quotient, and it's all in there how I did it. So if you have those numbers, you can calculate your own, or you can reach out to me and I will help you run the test and calculate this information so you have it for yourself. But what you want to find is you want that estrogen quotient to be at least 1.0 and higher. That is what his research suggested was protective against breast cancer. Even better if it's 1.5 and higher. Now, if you go lower than that, you start seeing increased risks of breast cancer, according to his research. So, if you're experiencing those symptoms of estrogen dominance, like the heavy bleeding and the cramping and the clotting, and your cycle is lasting 2 weeks, and you have endometriosis or PCOS or some of those other conditions, or you just want to know what your estrogen quotient is so you know what your relative risk of developing breast cancer is. It normal risk, high risk, low risk, all those kinds of things. I think this is a great piece of information that all women should have in their arsenal when they're trying to keep themselves healthy and free of some of the things that unfortunately just have become way too common in our society. So I hope you found that helpful, and thanks for watching.